We should now switch gears and talk about the cytochrome P450 system. Now, what is this cytochrome P450 system? Well, this P450 system refers to a superfamily or a broad collection of enzymes found mainly in the smooth endoplasmic reticulum of hepatocytes. So in the liver, these enzymes catalyze the metabolism of both exogenous drugs and toxins as well as endogenous compounds. We are talking about the P450 system right now because exogenous compounds, aka drugs, can affect this system. Here we have the liver and then some drugs. The P450 system will work at a nice normal pace and spit out metabolites at a constant rate. This represents the normal functioning within the body. There are many drugs that are metabolized through this pathway. There are also drugs that can be classified as inducers or inhibitors of this system. They are classified according to how they affect this P450 system. So, for example, the inducers will speed up the P450 system. Everything that is metabolized by the P450 system will be affected since the system is ramped up. The inhibitors are going to slow down the P450 system. If an inhibitor slows down this system, the drugs can stay in the system longer, and we're going to have a buildup of drugs within the system. This P450 induction or inhibition is the basis for many clinically important drug-drug interactions. Now, my tip to you is this: don't breeze over this section. I'm here to get you the maximum points on test day and maximize your test score. So here's your tip. Make note cards on this. Know these in and out. Study them the night before your test or the morning of your test. If you do this, you won't let an easy point or two pass by. So let's go ahead and start off with our inducers. Now, what are the P450 inducers? Well, remember, those are the drugs that ramp up the system, which increases the liver metabolism of certain drugs. These can be remembered with the mnemonic chronic alcoholics steal fen-phen and never refuse greasy carbs. And this stands for our chronic alcohol use, St. John's wort, phenytoin, phenobarbital, nevirapine, rifampin, griseofulvin, and carbamazepine. So here's our mnemonic. We have our two alcoholics, which are going to be stealing some fen-phen and not refusing greasy carbs. So now you know why I never made it in art school. Many drugs are substrates for our cytochrome P450 system. These are the drugs that get metabolized by the P450 system but don't necessarily speed it up or slow it down. These substrates can have altered concentrations in the body if an inducer or an inhibitor changes the speed of the system though. An important substrate that you need to remember on test day are going to include your antiepileptics, theophylline, warfarin, and oral contraceptive pills. We've already covered the drugs that induce our cytochrome P450 system. Now it only makes sense that now we should cover the inhibitors to the cytochrome P450 system. The P450 inhibitors can be remembered with the mnemonic AAA Racks in GQ magazine, and it stands for our acute alcohol abuse, ritonavir, amiodarone, cimetidine, ketoconazole, sulfonamides, isoniazid, grapefruit juice, quinidine, and macrolides, with the exception of azithromycin. Now to remember the inhibitors, just remember looking through a GQ magazine and seeing some AAA frame racks. Hopefully my artwork is so bad that you'll not be able to forget this. So on test day, I hope you think this subpar drawing during your test and think, man, that drawing was so bad that it actually helped get me a test point. Again, this is just pure memorization, plain and simple. So covering these lists a few times is often helpful. Many patients have allergies to sulfa drugs. It's an important skill to recognize which drugs have sulfa in them because patients with allergies can have a severe reaction to these. Now, what drugs should patients avoid with a sulfa allergy? These will include your probenecid, furosemide, acetazolamide, celecoxib, thiazides, sulfonamide antibiotics, sulfasalazine, and sulfonylureas. And you can remember this with the mnemonic popular facts with a lot of S's. Allergic patients can develop severe symptoms, including fever, urinary tract infection, a pruritic rash, Stevens-Johnson syndrome, hemolytic anemia, thrombocytopenia, agranulocytosis, and even urticaria or hives. Some of these reactions can be life-threatening, like Stevens-Johnson syndrome, and agranulocytosis, which can be also very dangerous. So here's an example of what Stevens-Johnson syndrome looks like. I hope you're ready for a practice question. Let's see how these concepts we just covered can show up on the USMLE. We have a 78-year-old man taking multiple medications, and he presents to the clinic for continued surveillance of 3 coronary stents that were placed 4 years ago. Warfarin prophylaxis was started following that cardiac catheterization and stent placement. He denies any recent change in diet, but he does note that another doctor started him on a new antibiotic pretty recently. The coagulation studies are shown below. We have a prothrombin time of 14 seconds, a partial thromboplastin time of 36 seconds, bleeding time of 5 minutes, and an INR of 1.05. Which one of the following medications has the patient most likely begun taking? Is it A, erythromycin, B, griseofulvin, C, isoniazid, D, ketoconazole, or E, ritonavir? I'll give you a second to think about it. Now here are some reference values that you can use to answer this question. Just like on the USMLE test, you can pull up some standardized lab values. You pull those up and write them down here. So here's a reference that you can use for this question. Think you know it? Well, if you said B, griseofulvin, then you'd be correct. I told you that the P450 system has inducers, substrates, and inhibitors, and all of these would be very important. So let's go ahead and see why B is the correct answer. This question is saying that a patient uses warfarin, or an anticoagulant. Warfarin is going to affect our prothrombin time, the PT, not the partial thromboplastin time, or the PTT. So there are some distractors in this question. Next, we need to look at the actual value of our prothrombin time. So if this patient is given warfarin, we would expect this to be increased. Looking at our reference values, though, we see that it falls within our normal range. That means that the warfarin isn't doing its job correctly. This question expects you to realize that the liver's P450 system is now metabolizing the substrate warfarin at a faster rate, which is going to decrease warfarin to subtherapeutic levels. Thus, we see our normalized prothrombin time. So what drug is inducing the cytochrome P450 system to ramp up the metabolism of our warfarin? Well, out of all the options here, the only one that is an inducer of the cytochrome P450 system is griseofulvin. The rest of these are going to be inhibitors. So in summary, griseofulvin was given, which ramped up our P450 system, which metabolized our warfarin at a faster rate, and now our warfarin levels in the blood are at a subtherapeutic level, causing our prothrombin time to normalize. And we see a pretty basic INR. If the patient was given warfarin at an adequate rate or adequate level in the blood, we would see this a little higher. So hopefully this makes sense and the end is in sight. Only one more short section to go. I hope you'll join me to finish off the pharmacology section.